Welcome to Evidence Mastery. Have you ever looked at the results of a big, important study and just been left thinking, okay, but what does that really mean? Well, today, we're going to dig into why that happens and how a surprisingly simple framework can force our research questions to be so precise that the answers become crystal clear.
So, the concepts we're going to be walking through today come directly from real-world evidence, Principles and Practice by Dr. Massoud Toussi. It's a key book in the Evidence Mastery series, and we're going to unpack a really revolutionary idea from it that's changing how we all design and interpret research.
Okay, picture this, a real-world drug trial. In the real world, patients aren't perfect, right? They might stop taking the drug. They might need other medications. Maybe they miss a few doses. So, what is the drug's real effect? The tricky part isn't just that the answer is complicated. It's that, a lot of the time, we're starting out by asking the wrong, totally vague question.
And that right there is the heart of the problem. When you ask a vague question, you get an ambiguous and often really misleading answer. This is a huge issue that can mess up everything from the most pristine clinical trials to the messiest real-world evidence.
So, let's look at a real-life example, the Floella trial. It was comparing two ways of delivering fluids during surgery. Now, the standard analysis, what we call intention to treat, where you just look at the group a patient was assigned to, not what treatment they actually got, it found no difference at all. But when researchers asked a much more precise question, focusing only on the patients who actually had the surgery as planned, boom, they found a significant effect. The vague question totally diluted the results and almost buried the truth.
Now, there's a technical name for these real-world curveballs, like a surgery getting canceled or a patient needing some kind of rescue medication. It's called an intercurrent event. It's basically anything that happens after a study starts that can make our data all muddy.
So how do we clean up that mess? How do we fix this? Well, the good news is we don't have to guess. There's a formal framework that was designed specifically to bring this kind of military-grade precision to our research questions.
And this solution is called the Estimand Framework, and it's all laid out in the international ICH M14 guideline. The best way to think of it is like a blueprint. It's a blueprint that forces researchers to define with incredible precision exactly what treatment effect they're trying to measure. It leaves zero room for ambiguity.
Okay, so this framework is built on 5 core components, or what it calls attributes. And the idea is, if you define all 5 of these, you end up with a complete, totally crystal clear research question. So let's break them down.
So it starts with 4 elements that will probably sound pretty familiar to you. The population you're studying, the treatment conditions you're comparing, the endpoint or the outcome you're measuring, and the summary measure you'll use, like a risk ratio or a mean difference. But then, and this is the key, the framework adds a game-changing 5th attribute, a pre-planned strategy for handling of intercurrent events. This, right here, is the secret sauce.
If you've ever used the PICO framework, population, intervention, comparator, outcome, you can see this is kind of like PICO on steroids. The Estimand Framework just makes it way more robust by adding that summary measure and, most importantly, forcing us to figure out a strategy for those messy intercurrent events before we even start. It takes us from a good question to a bulletproof one.
And this brings us to the real technical core of the framework, the 5 different strategies for handling these intercurrent events. And I gotta stress, the strategy you pick isn't just some statistical detail. It fundamentally changes the scientific question you're asking.
First up, we've got the treatment policy strategy. This one asks, what's the effect of the policy of prescribing a drug? It includes the messy reality that some people will just stop taking it. So the discontinuation isn't a problem you have to fix, it's actually part of the outcome you're measuring. This is absolutely perfect for regulators or public health bodies who need to know the real-world impact of their recommendations.
Next up is the composite strategy, and this one is pretty clever. It actually incorporates the event right into the outcome itself. So for example, let's say a patient dies during a study on quality of life. Well, we could assign that patient the worst possible quality of life score. This makes sure a tragic event like a death isn't just treated as missing data, which could totally skew the results.
Then we have the while on treatment strategy. This one does exactly what it sounds like. It focuses only on the period before the intercurrent event happened. So we might ask about a drug's effect on symptoms right up until the patient stopped taking it or until they had to take a rescue medication. It answers a really specific question about the effect only during active treatment.
The hypothetical strategy? Well, this is our what-if scenario. What would the effect have been if the patient had been able to stick with the drug?
This is a super powerful question, but, and this is a big but, it requires you to make some really strong and often untestable assumptions about what would have happened in that alternate reality.
And finally, there's the principal stratum strategy. This one asks an incredibly precise question about a very specific subgroup of people. For instance, what is the treatment's effect only in the type of patient who would take the full course of the medication no matter what? So it's not really about what happened to the patients in the trial, but about the effect in a theoretical population of perfectly compliant people.
Okay, so you might be thinking, this all sounds great for a tightly controlled clinical trial, but what about real-world evidence? Well, that's where this framework becomes even more essential.
I mean, the ICH M14 guideline on real-world data says it perfectly. The strength of your evidence depends just as much on having rigorous methods as it does on having good data. And the Estimand Framework, it gives us exactly that methodological rigor.
And here's where it all clicks together. The Estimand attributes map directly onto the biggest challenges we face in RWE. Population in a trial becomes defining your study population in a messy claims database. Treatment becomes how you operationally define exposure. And handling intercurrent events is the exact same thought process as addressing bias and confounding. The principles are 100% the same, it's just the context that changes.
So, why does all this technical stuff really matter? Because at the end of the day, this framework gives us something incredibly powerful: precision.
So, what's the big takeaway here? The Estimand Framework forces a perfect alignment between what a study sets out to do and the methods it actually uses. It makes sure that when you read a result, you know exactly what question was being answered. This lets everyone, from regulators to doctors to patients, interpret the evidence correctly. It gives us all the tools to look past the final number and really critically appraise the method itself.
And that kind of leaves us with a final thought to chew on. In a world full of imperfect data and messy realities, maybe the relentless pursuit of asking the perfect question is actually far more valuable than the search for a single perfect answer. Now, if this has your brain buzzing and you really want to dive deeper into all the technical details, the book that inspired this whole explainer is the absolute best resource. It's Real-World Evidence, Principles and Practice by Dr. Massoud Toussi. You can find it on Amazon.com.
And of course, for more explainers that break down these kinds of complex topics in healthcare research, please make sure to subscribe to the Evidence Mastery channel right here on YouTube. Thanks so much for watching.